Glaucoma, understanding the risks and protecting your vision for life. Glaucoma is a group of eye diseases that, if left untreated, can lead to irreversible vision loss and even blindness. It's often called the silent thief of sight, because it typically progresses without noticeable symptoms until significant and permanent damage has occurred. Once vision is lost due to it, it cannot be restored, which is why early detection and proactive management are so critical. At its core, glaucoma involves damage to the optic nerve, the vital bundle of nerve fibers sending visual information from your eye to your brain. This damage is frequently linked to elevated pressure inside your eye, known as intraocular pressure, IOP, though other factors like blood flow and genetics also play crucial roles. This comprehensive overview aims to provide clear, essential information about glaucoma. We'll explore its various forms, including how it impacts both aging adults and younger individuals, even infants and children. You'll also learn about its complex relationship with common eye conditions like cataracts, the importance of regular, thorough eye exams for early diagnosis, and insights into how lifestyle choices, specific medications, diet, and supplements can relate to managing your eye health. Our goal is to empower you with knowledge to better understand glaucoma and proactively care for your vision throughout your life. The impact of aging on glaucoma risk. Aging is one of the most significant and well-established risk factors for glaucoma, particularly for the most common forms. While it's a common misconception that all older adults automatically have high eye pressure, the reality is more nuanced. Aging dramatically increases the risk of developing both elevated eye pressure and a more vulnerable optic nerve. Here's how aging contributes. Less efficient drainage system. As we age, the eye's natural drainage system, specifically a spongy tissue called the trabecular meshwork, which acts like a filter or drain for the eye's internal fluid, can become less efficient. This is akin to a drain slowly getting clogged over time. When the aqueous humor, the clear fluid inside the front of your eye, doesn't drain as effectively, it can build up, leading to an increase in intraocular pressure, IOP. This increased likelihood of higher eye pressure in older adults is a primary reason for the higher incidence of glaucoma in this demographic. Increased optic nerve vulnerability. Even if an older person's eye pressure isn't exceptionally high, their optic nerve might be more susceptible to damage than a younger, healthier nerve. Age-related changes, such as reduced blood supply to the optic nerve or cellular changes within the nerve itself, can make it more fragile and less able to withstand even normal levels of pressure. This phenomenon is central to normal tension glaucoma, where optic nerve damage occurs despite eye pressure remaining within the statistically normal range. Lens thickening and angle closure glaucoma. With age, the natural lens inside the eye, the part that helps you focus and where a cataract forms, tends to thicken and expand. In some individuals, this thickening can push the iris, the colored part of the eye, forward, narrowing the drainage angle of the eye. Think of the lens swelling like a balloon inside a small room, pushing against the door, the iris, that leads to the drain, eventually blocking it. If this angle becomes completely blocked, it can lead to a sudden and dangerous spike in eye pressure, causing acute angle closure glaucoma, a medical emergency. The different phases of glaucoma. Glaucoma isn't a single condition, but rather an umbrella term for several distinct types. Primary open-angle glaucoma, POG. This is by far the most prevalent form, especially in older adults. It's a slow-progressing disease where the eye's drainage system appears open, yet fluid doesn't exit as efficiently as it should. The insidious nature of POG means it often goes undetected for years because initial vision loss occurs in the peripheral, side, vision, which the brain often compensates for, or the other eye takes over. Angle closure glaucoma. This type is more acute and can be a medical emergency. It occurs when the eye's drainage angle, the area where fluid drains out, becomes suddenly blocked, leading to a rapid and severe spike in eye pressure. Symptoms like intense eye pain, sudden blurred vision, redness, and the perception of halos around lights can appear quickly. This requires immediate medical attention to prevent severe, rapid, and irreversible vision loss. Normal tension glaucoma. In these cases, optic nerve damage occurs despite eye pressure remaining within the normal range. As discussed, aging can be a significant contributing factor here, making the optic nerve more vulnerable. Secondary glaucoma. This form arises as a consequence of another underlying medical condition, an eye injury, the use of certain medications, like corticosteroids, or other existing eye problems. Congenital glaucoma, a rare type that affects infants, typically due to improperly formed drainage canals in the eye at birth. Can young people get glaucoma? Understanding glaucoma across the lifespan. While most commonly associated with aging, it's crucial to understand that glaucoma can affect individuals of any age, including infants, children, and young adults. Though less common than in older populations, glaucoma in younger people can sometimes be more aggressive or linked to unique underlying causes. Here are the main types of glaucoma seen in younger individuals. Congenital glaucoma. Infantile glaucoma. This rare but serious form is present at birth or develops within the first few years of life, most often diagnosed in the first year. It's caused by the incomplete or incorrect development of the eye's drainage system during fetal development. Unlike adult glaucoma, symptoms are often visually apparent and should prompt immediate medical evaluation. Ophthalmos. The high pressure can cause the developing eye to enlarge, making one or both eyes appear unusually large. Photophobia. Extreme sensitivity to light, causing the child to frequently squint or avoid bright light. Epiphora. Excessive tearing. Cloudy cornea. The normally clear front part of the eye can become hazy or cloudy due to swelling caused by the high pressure. Treatment. Early diagnosis and often surgical intervention are critical to correct the drainage issue and preserve vision. Juvenile open-angle glaucoma, JOAG. This form of primary open-angle glaucoma is diagnosed in children, teenagers, or young adults, typically between the ages of 3 and 40. JOAG is often hereditary and may be linked to specific genetic mutations affecting the eye's drainage system. Similar to adult POG, it often has no noticeable symptoms in its early stages as vision loss progresses subtly from the periphery. However, young people with JOAG often experience very high eye pressures and can face more rapid progression of vision loss if left untreated. Treatment usually involves medicated eye drops, and frequently, laser procedures or surgery due to the typically high pressures. Secondary glaucoma in young people. This can occur at any age as a result of other underlying conditions or events, including eye trauma. Injuries to the eye can damage the delicate drainage system. Ocular inflammation. Uveitis. Chronic inflammation inside the eye can block the drainage pathways. Steroid-induced glaucoma. Prolonged use of corticosteroid medications, especially eye drops or oral steroids, can significantly elevate eye pressure. Other eye conditions. Certain conditions like pigment dispersion syndrome, where pigment from the iris clogs the drainage system, or following previous eye surgeries can lead to secondary glaucoma. Systemic diseases. Some rare genetic syndromes or systemic illnesses can also be associated with glaucoma. Diagnosing glaucoma in young children can be challenging due to their limited ability to cooperate with standard eye tests, sometimes requiring specialized examinations under anesthesia. This underscores the importance of prompt evaluation by an eye care professional if a child exhibits any unusual eye symptoms or if there's a family history of glaucoma. The interplay between glaucoma and cataracts. Glaucoma and cataracts are two of the most common age-related eye conditions, and it's very common for older adults to develop both. While they are distinct diseases affecting different parts of the eye, they can be closely related in their development and management. Shared risk factor, aging. Both conditions become significantly more prevalent as people age, making it common for them to coexist in the same individual simply due to the natural aging process. Cataracts affecting glaucoma. In some cases, a developing cataract can directly influence glaucoma. Angle closure glaucoma, as the eye's natural lens, where a cataract forms, thickens and swells with age, it can push the iris, the colored part of your eye, forward, narrowing the eye's drainage angle. Think of the lens swelling like a balloon inside a small room, pushing against the door, the iris, that leads to the drain, eventually blocking it. If this angle becomes sufficiently narrow or blocked, it can trigger acute angle closure glaucoma, causing a rapid and dangerous rise in eye pressure. In these situations, cataract surgery to remove the enlarged lens can be a crucial part of the glaucoma treatment, as it helps to open the drainage angle. Obscured monitoring. A dense cataract can make it difficult for an eye doctor to get a clear view of the optic nerve and other structures at the back of the eye, which can hinder accurate monitoring of glaucoma progression. Glaucoma treatment affecting cataracts. Conversely, certain glaucoma treatments can impact cataract development. Medications. Some glaucoma eye drops, particularly long-term use of steroid eye drops, can accelerate cataract formation. Surgery. Some types of glaucoma surgery, especially filtering procedures, can sometimes speed up the progression of existing cataracts or encourage new ones to form. Holistic management and combined procedures. When a patient has both conditions, the treatment plan often becomes integrated. While the underlying causes of cataracts, lens clouding, and glaucoma, optic nerve damage, are different, the overall management approach can be holistic and synergistic. Surgical synergy. For patients needing both cataract surgery and glaucoma intervention, modern techniques often allow for combined procedures. Minimally invasive glaucoma surgeries, MIGS, for example, are smaller procedures that can frequently be performed at the same time as cataract surgery through the same incision. This allows for addressing both conditions in one surgical session, potentially reducing the need for multiple surgeries and sometimes even lowering the number of glaucoma medications required afterward. Post-surgical monitoring. Patients with glaucoma who undergo cataract surgery require careful post-operative monitoring of their eye pressure, as temporary spikes can occur. It is critical to remember the fundamental difference. Vision loss from cataracts is reversible with surgery, replacing the cloudy lens, whereas vision loss from glaucoma is irreversible because it involves permanent damage to the optic nerve. This distinction underscores the paramount importance of early detection and ongoing management for glaucoma. The deceptive nature of symptoms. The most dangerous aspect of common glaucoma, particularly open-angle glaucoma, is its lack of early symptoms. Vision loss typically begins subtly in the peripheral, side, vision, and many individuals remain unaware of the problem until substantial, irreversible damage has already taken place. This is precisely why it's earned its "silent thief" moniker. When symptoms do appear, especially in more advanced or acute forms like angle closure glaucoma, they can include severe eye pain, blurred or hazy vision, seeing rainbow-colored circles or halos around bright lights, redness in the eye, nausea and vomiting, often accompanying severe eye pain, headache. Diagnosis and the path to preservation. Given its stealthy progression, early detection of glaucoma hinges on regular, comprehensive eye exams. These thorough evaluations go far beyond simply checking your vision for glasses and are crucial for identifying eye diseases in their earliest stages, often before you notice any symptoms. A complete eye exam typically includes patient history, a discussion about your general health, medications, family eye history, and any current vision concerns. Visual acuity test, measuring how clearly you see at various distances using an eye chart. Refraction assessment, determining your precise prescription for eyeglasses or contact lenses. Eye muscle function, ocular motility, test, evaluating how well your eyes move and work together. Peripheral, side, vision test, visual field test/perimetry. You'll look at a central light, and small lights will flash in your peripheral vision. You press a button when you see them, helping your doctor map out any blind spots caused by optic nerve damage. Eye pressure test, tonometry. A vital test for glaucoma screening, measuring the pressure inside your eye. This can be done with a gentle puff of air or by lightly touching a probe to the eye surface after numbing drops. Slit lamp examination, a highly magnified view of the front structures of your eye, eyelids, cornea, iris, lens, to detect conditions like cataracts, dry eye, or infections. Dilated eye exam, retinal examination/ophthalmoscopy. After eye drops are placed to widen your pupils, your vision will be blurry and sensitive to light for several hours, so arrange for a ride home. This dilation allows the doctor to get a wide, clear view of the back of your eye, including the retina, macula, and most importantly, the optic nerve, where signs of glaucoma damage, like cupping, where the nerve head looks more hollowed out due to lost nerve fibers, are assessed. Who performs these vital exams? Optometrists versus ophthalmologists. For a complete eye exam that includes glaucoma detection, you can confidently see either an optometrist or an ophthalmologist. Both are highly qualified eye care professionals, though their training and scope of practice differ. Optometrists, OD, are primary eye care providers who complete 4 years of optometry school after an undergraduate degree. They are fully qualified to perform comprehensive eye exams, diagnose a wide range of eye diseases, including glaucoma, cataracts, macular degeneration, and diabetic retinopathy, and prescribe eyeglasses and contact lenses. For glaucoma, optometrists can detect the early signs, diagnose the condition, and initiate treatment, typically by prescribing medicated eye drops. They also manage many glaucoma patients long-term. If an optometrist identifies a complex case, rapid progression, or a need for surgical intervention, they will refer you to an ophthalmologist. Ophthalmologists, MD or DO, are medical doctors who complete medical school, an internship, and a 3-year residency specializing in eye care and eye surgery. Many pursue further fellowship training in specific eye subspecialties. They can do everything an optometrist can, but their medical and surgical training allows them to treat more complex eye conditions and perform eye surgeries, e.g., cataract surgery, glaucoma surgery, LASIK. For glaucoma, ophthalmologists can diagnose all types and provide the full spectrum of treatment, including medications, laser procedures, and surgical interventions. In essence, optometrists are your first stop for general eye health, including glaucoma screening and ongoing medical management. They play a crucial role in early detection. If a condition becomes too complex or requires surgery, they will refer you to an ophthalmologist. When to seek an eye exam for glaucoma detection. Regular, comprehensive eye exams are your best defense against glaucoma. The recommended frequency depends on your age and risk factors. For individuals with no known risk factors for glaucoma. Under 40, every 5 to 10 years. Ages 40 to 54, every 1 to 3 years. Ages 55 to 64, every 1 to 2 years. Ages 65 and older, every 1 to 2 years, or more frequently as advised by your doctor. For individuals with risk factors for glaucoma, these include age 40+, family history of glaucoma, African American, Hispanic/Latino, or East Asian ancestry, high eye pressure, diabetes, high blood pressure, extreme nearsightedness/farsightedness, history of eye injury or certain steroid use. Under 40, every 2 to 5 years. Ages 40 to 54, every 1 to 3 years. Ages 55 to 64, every 1 to 2 years. Ages 65 and older, every 6 to 12 months. It is particularly important for parents to be aware of the signs of congenital glaucoma in infants and seek immediate medical attention if symptoms like enlarged or cloudy eyes, excessive tearing, or light sensitivity are observed. Similarly, young people with a family history of glaucoma should begin regular screenings earlier. Preventing and slowing glaucoma progression, proactive steps you can take. While some risk factors for glaucoma, like genetics, age, and ethnicity, are beyond our control, there are significant steps you can take to lower your risk or slow down the progression of the disease if you are diagnosed. Since vision loss from glaucoma is irreversible, the focus is always on preventing further damage and enabling early intervention. 1. Prioritize regular comprehensive eye exams. This is, without a doubt, the most crucial step. Glaucoma often progresses without symptoms until significant, irreversible vision loss has occurred. Regular checkups allow your eye doctor to track changes and intervene promptly. 2. Adhere strictly to your glaucoma medication. If you've been diagnosed with glaucoma or ocular hypertension, high eye pressure without optic nerve damage, consistent and correct use of prescribed eye drops is the single most effective way to slow down progression. Even missing a few doses can allow eye pressure to rise and potentially cause further damage to the optic nerve. Glaucoma treatment is typically lifelong, so communicate any side effects or difficulties with your doctor. They can often adjust your regimen or help find solutions. 3. Maintain a healthy lifestyle. General health profoundly influences eye health. Balanced diet. Focus on a diet rich in antioxidants, found in colorful fruits and vegetables, especially dark, leafy greens like spinach and kale. Foods rich in omega-3 fatty acids, fatty fish, flax seeds, may also support optic nerve health. While staying hydrated is crucial, avoid chugging very large volumes of water, e.g., a liter or more, in a very short time, as this can cause a temporary spike in IOP. Sip water steadily instead. Moderate caffeine intake is generally fine, but excessive consumption, e.g., more than 5 cups of strong coffee daily, can temporarily increase intraocular pressure in some individuals. Regular exercise, moderate aerobic exercise, like brisk walking, jogging, cycling, swimming, can help lower intraocular pressure and improve blood flow to the optic nerve. Aim for at least 30 minutes most days. However, consult your eye doctor about specific exercises, as some activities, like inverted yoga poses, headstands, or heavy straining during weightlifting, can temporarily increase pressure in your head and eyes, which can be detrimental for the optic nerve if you have glaucoma. Maintain a healthy weight. Obesity can be linked to higher eye pressure and an increased risk of glaucoma. Manage underlying health conditions. Keep systemic conditions like diabetes, high blood pressure, and high cholesterol well controlled, as they can negatively impact eye health and exacerbate glaucoma. 4. Protect your eyes from injury. Eye injuries can directly lead to secondary glaucoma. Always wear appropriate safety glasses or goggles when engaging in activities that pose a risk to your eyes, such as sports, DIY projects, gardening, or working with chemicals. 5. Manage stress. Some research suggests that chronic stress may contribute to elevated IOP and could potentially worsen glaucoma. Incorporate stress-reducing activities like meditation, deep breathing exercises, or hobbies into your routine. 6. Avoid smoking and limit alcohol. Tobacco use is linked to higher intraocular pressure and negatively affects blood flow to the optic nerve. Quitting smoking is paramount for overall health, including eye health. While moderate alcohol consumption may not be harmful, heavy drinking can increase your risk of glaucoma. Specific considerations, medications, diet, and supplements. Being mindful of specific medications, dietary choices, and supplement use can also play a role in managing glaucoma risk and progression. Specific medications to watch for. It is crucial to inform every doctor and pharmacist you see that you have glaucoma, or are at risk, so they can avoid prescribing medications that could be harmful. Always review all your medications, prescription, over-the-counter, and even herbal/supplements, with your eye doctor. Corticosteroids, steroids. This is the most common and significant class of medications that can induce or worsen glaucoma by increasing eye pressure. This risk applies to all forms of steroids, including eye drops, e.g., for allergies, inflammation. Oral pills, e.g., prednisone, dexamethasone. Inhaled steroids, for asthma, COPD. Nasal sprays, for allergies. Topical skin creams/ointments. Injections, e.g., into joints, near the eye, or intravenously. Individuals with pre-existing glaucoma, a family history of glaucoma, or those known to be high responders to steroids are particularly at risk. Anticholinergic medications. These drugs can affect the eye's drainage system and dilate the pupil, potentially triggering acute angle closure attacks in susceptible individuals, those with narrow angles. This class includes certain antidepressants, e.g., tricyclic antidepressants, some SSRIs. Older, sedating antihistamines, e.g., diphenhydramine. Decongestants, e.g., pseudoephedrine, phenylephrine, often in cold/flu remedies. Medications for overactive bladder/incontinence. Some respiratory inhalers for asthma/COPD. Some muscle spasm medications and anti-nausea medications. Sulfa-containing drugs, sulfonamides. Certain sulfa drugs can cause swelling of eye structures, leading to sudden, acute angle closure glaucoma. Topiramate, Topamax, used for migraines, seizures, and weight loss. This is a particularly important medication to discuss with your eye doctor if you have glaucoma. Some antibiotics, e.g., trimethoprim sulfamethoxazole, and certain diuretics may also carry this risk. Foods to watch for, and potentially limit. While diet is more about general health and less about direct prevention of glaucoma, some choices warrant attention. Excessive caffeine. As mentioned, very high intake can temporarily increase IOP. Trans fats and high saturated fats, found in fried and processed foods, these can contribute to systemic inflammation and cardiovascular issues, indirectly affecting ocular blood flow. Simple carbohydrates, sugary drinks and highly processed foods can cause rapid blood sugar spikes, potentially linked to higher IOP and blood pressure. Large volumes of water at once, as noted, sip steadily. Excessive alcohol, heavy or chronic alcohol intake can negatively impact overall health, including optic nerve health. Foods to prioritize, beneficial for overall eye health and potentially glaucoma management. Leafy green vegetables, kale, spinach, collard greens are rich in nitrates, antioxidants, lutein, zeaxanthin, and vitamins that support ocular blood flow and combat oxidative stress. Colorful fruits and vegetables, berries, citrus fruits, carrots, and bell peppers provide essential antioxidants, vitamin C, A, E. Omega-3 fatty acids, found in fatty fish, salmon, tuna, flax seeds, and walnuts. These are anti-inflammatory and may help improve ocular blood flow and modestly reduce IOP. Nuts and seeds, good sources of vitamin E and other beneficial nutrients. Supplements, important considerations and lack of definitive evidence. The evidence for specific supplements preventing or treating glaucoma is currently limited and inconclusive. While many supplements are marketed for eye health, they should never replace prescribed medical treatment for glaucoma. Think of these as only potentially supportive to general eye health, rather than direct treatments. Commonly discussed supplements, with limited or inconclusive evidence for glaucoma. Ginkgo biloba and bilberry extract. Some studies have explored their potential to improve blood flow, but there is no robust clinical evidence to definitively show benefit in preventing or treating glaucoma progression. Furthermore, ginkgo biloba can interact with blood-thinning medications. Always consult your doctor, especially if you are on blood thinners or anticipating surgery. Omega-3 fatty acids, B vitamins, e.g., B3/niacin, N-acetylcysteine, NAC, coenzyme Q10, CoQ10, resveratrol, these are areas of ongoing scientific investigation for their potential roles in neuroprotection, protecting the optic nerve, or modest IOP reduction. However, more human clinical trials are needed to establish their efficacy, safety, and optimal dosing specifically for glaucoma patients. They are not yet established treatments for glaucoma. The golden rule: always maintain open communication with your ophthalmologist or eye care professional. Never start or stop any medication or supplement without their guidance. They can provide personalized advice based on your specific glaucoma type, stage, overall health, and other medications you are taking, ensuring the safest and most effective approach to preserving your vision. The horizon of glaucoma treatment: emerging innovations. While current glaucoma treatments effectively manage eye pressure and slow progression for many, research continues to push the boundaries, offering exciting new possibilities for the future. Sustained-release medication implants: imagine not having to remember daily eye drops. Newer innovations include tiny, sustained-release implants that are placed in or on the eye by your doctor, e.g., Durista, iDose TR. These devices slowly release pressure-lowering medication over several months, ensuring consistent drug delivery and potentially improving adherence for patients who struggle with daily drops. This can offer a more convenient and effective way to manage IOP for certain individuals. Neuroprotection therapies: beyond simply lowering eye pressure, a significant area of research focuses on directly protecting the optic nerve from damage. These neuroprotective strategies aim to make the optic nerve more resilient to various stresses, including high pressure or reduced blood flow. While still largely in clinical trials, this field holds immense promise for preserving vision even in cases where pressure control alone isn't sufficient. Gene therapy: this cutting-edge field explores the possibility of using genetic material to treat glaucoma at a fundamental level. Researchers are investigating ways to introduce genes that help the eye produce its own pressure-lowering agents. Deliver genes that protect optic nerve cells from damage or even help regenerate them. Correct underlying genetic mutations known to cause certain forms of glaucoma. While complex and still in early trial phases, gene therapy represents a long-term vision for potentially revolutionizing how glaucoma is treated. Advanced diagnostics and personalized medicine: ongoing advancements in imaging technologies, like OCT angiography, allow for even earlier and more detailed detection of subtle changes in the optic nerve and blood flow. This data, combined with genetic insights, could lead to more personalized treatment plans tailored to an individual's specific type of glaucoma and risk factors. It's important to remember that many of these innovations are still under investigation, in clinical trials, or have very specific indications. They are not yet universally available or a replacement for existing, proven treatments. However, they represent a hopeful future for glaucoma management, continually striving for better vision preservation and improved quality of life for patients. Living with glaucoma and finding support. A glaucoma diagnosis can be a challenging and emotional experience. It's normal to feel worried, frustrated, or anxious about your vision. Remember that you are not alone, and managing your emotional well-being is an important part of living with the condition. Emotional support: don't hesitate to discuss your feelings with your eye doctor, family, or friends. Support groups, either in person or online, can also provide a valuable community where you can connect with others facing similar challenges. Low vision services: if glaucoma has already caused some vision loss, specialized low vision services can help. Low vision specialists can teach you strategies and provide adaptive devices, like magnifiers, specialized lighting, or digital aids, to maximize your remaining vision and maintain your independence and quality of life. Patient resources and advocacy: reputable organizations dedicated to eye health and glaucoma research offer extensive information, patient education materials, and often directories for support groups. Examples include the Glaucoma Research Foundation, the American Academy of Ophthalmology, and the Prevent Blindness Organization. Hope through research. It's important to know that research into glaucoma is constantly advancing. Scientists are continuously working to better understand the disease, develop new diagnostic tools, and discover more effective treatments, including neuroprotective therapies to prevent optic nerve damage and innovative surgical techniques. Conclusion. Glaucoma, truly the silent thief of sight, is a complex and often insidious eye disease that can lead to irreversible vision loss. While it is predominantly associated with aging, it's vital to recognize its presence in younger individuals, including infants and children, and its intricate connections with other age-related conditions like cataracts. The cornerstone of battling glaucoma lies in early detection through regular, comprehensive eye exams performed by qualified eye care professionals, whether an optometrist or an ophthalmologist. These thorough examinations go far beyond simple vision checks, meticulously evaluating the health of your optic nerve and the internal pressure of your eyes. Furthermore, being informed about factors that influence glaucoma progression is incredibly powerful. This includes diligently adhering to prescribed treatments if diagnosed, embracing a healthy lifestyle, through diet, exercise, and stress management, protecting your eyes from injury, and being acutely aware of how certain medications and supplements can relate to your eye health. Beyond these proactive measures, understanding the emotional aspects of a glaucoma diagnosis and knowing that support and resources are available can significantly contribute to lifelong well-being. By understanding the diverse facets of glaucoma, recognizing its risk factors across all ages, and committing to lifelong proactive eye care, you empower yourself to preserve your precious vision against this challenging condition. Don't wait for symptoms, make regular eye health a priority for yourself and your loved ones.